evening, whatever part of the world, whatever time zone, whatever continent, whatever countries, wherever you are, we wish you all the good health and wellness. Hope you're taking care of yourself, your family, your friends, your neighbors, your community, your society, your people, and your civilization. Ladies and gentlemen, the entire world is Vasudhaiv Kutumbakam. The whole world is one family. And particularly our chamber, when we deal with, we have got 31 million Indians abroad in different countries, and they are into different sectors, different arenas, different professions, whatever they are doing. We are proud of them, and they're bringing so much of proud to India. This evening, this morning, this afternoon, whatever time zone you are in, people are joining from different countries. We extend a very warm welcome, and we are privileged to share with all of you today's 974th webinar during this pandemic. And on 21st of June, that's on International Yoga Day, we would be celebrating 1,000 webinars with UNESCO. So ladies and gentlemen, this morning, this afternoon, this evening, wherever you are, hold your cup of tea, cup of coffee, your breakfast, your lunch, your evening tea, or even if you're enjoying your early dinner, wherever you are, let's meet Dr. Ravul Jindal. He's the director of the Vascular and the Endovascular Surgery, Fortis Hospital, Mohali. That's in the beautiful state of Punjab in India. And he's also International Ambassador, American Venous Forum. We extend a very warm welcome, and today is a very relevant subject which people have requested us, COVID and vascular diseases, whatever we have got. We will be covering all that, but before that, we would just share a few of the slides with all of you so that we are on the common frequency. Today is a very important day, Ministry of Labor and Employment in India, but world over. Today is our World Day Against Child Labor, 12th of June 2021. Your voice can help pull them out. Every child needs a bright future. Our chamber is proud to meet all of you, greet all of you, treat all of you, and to be with you this morning, this afternoon, this evening. I'm so very happy that right from Texas, Lamar, Massachusetts, Los Angeles, it's early morning, San Francisco, the people, those are joining me. I'm proud of all my brothers and sisters. Great hearty welcome to all of you. It's quite late. It's around 10:30, 10:40 in Taiwan, South Korea, but people are joining. Hearty welcome. And of course, Southeast Asia also, right from Myanmar, Cambodia, Laos, Singapore, Malaysia, Thailand, Indonesia, Philippines, Brunei. I know you are almost 2 hours or 2 hours, 15 minutes, different time zones ahead of India. Central Asia, people are still enjoying evening tea. Great, let them enjoy. And coming to Middle East also, all that area, people are enjoying. South Asia, and then of course, our beautiful Bharat, what we talk about. So hearty welcome to all of you. Our chamber is proud to share with all of you that with the Ministry of Commerce and Industry, Government of India, where the chamber had been working very deeply, and along with the think tank, there were 12 identified sectors by the Government of India, which are to be focused on service industry, because there are three components: agriculture, manufacturing, and services. Our chamber basically focuses on services sector. And we are taking today one of the important sector for all of us, that's the health sector. And in health sector, we have got a specific agenda. We all are meeting this morning, afternoon, evening. You are on the YouTube live, GS Motivator. You're on the Facebook, Gulshan Sharma. You're on the Twitter of the chamber, that is @ICSI India. Do join us. And also you're requested to share your views, your questions, because I have requested today's distinguished guest to keep last 10-15 minutes for some questions to be taken. Now, 20th, when I talk about 29th of July 2020, the Honorable Prime Minister of India gave the signal to the new education policy. And this new education policy is bringing the complete change, how there should be a holistic education. And our chamber from time to time has strongly recommended why music is not a part of education, dances, gamification, happiness, humor, fun, creativity, curiosity, storytelling, stimulation, following your passion, talent exhibition, stress-free education, technology-based education, vocational and skill-based education, and outdoor activities and nature-based education. We are proud to share in India, our chamber, with the help of Indian diaspora, we brought India's first finishing school for service industry way back in 1994 when we started with Punjabi Parvasi Divas. Pravasi Bharti Divas started in 2003 with the vision of then the Honorable Prime Minister of India, late Shri Atal Bihari Vajpayee ji. And over here, this collaboration and confluence is from the world over, where all the dignitaries coming together and giving their valuable support. And now we wish to share with all of you, our vision is the children whose parents cannot afford education, quality education, need-based education, today's education, our chamber is coming up with the E-Gurukul Gyan Yagya. No money will be charged from any child, irrespective of your country, continent, place, wherever you are. Today also we are doing beaming. 12 hours we have got a beaming every day from the chamber. One was Guru Shiksha Parampara. That was the earlier Gurukuls which we had. And now in today's time is going to be e-learning. Wherever you are, you would enjoy over there itself. And it's all coming as a gesture free of cost for you. You remember that Nalanda University also 10,000 youth were on the scholarship. Now, our chamber has taken the vision, teacher and youth empowerment is very important. 2021, we have dedicated for that. We are organizing almost 28 webinars per week. You name the subject and it is there. You talk about the area related to services sector and it is there. So we are proud that our chamber is in a very humble way trying to contribute whatsoever best we can do during the COVID. On 1st of February, Nirmala Sitharamanji, the Honorable Finance Minister of India, she announced the budget. In that budget, she told 100 scenic schools to come up in the PPP mode in India. That is with the help of the NGOs, private schools, state governments. And you would be proud to know that our chamber organized 31 webinars with the Army, Navy, Air Force, and civilian officers, directly or indirectly associated with when we talk about scenic schools, either in the past or they wish to be the part of these scenic schools in future. Right, let's move on. Our chamber wish to share with all of you that during this pandemic, we have collected the data and a lot of research has been carried out from 149 countries almost. What kind of a world will be there tomorrow? And how do we see the world order? Over there, the basic food, basic health, and basic education is very important. B2B is no more business to business. It's back to basics, sustainable development. So ladies and gentlemen, whatever human mind can conceive and believe, it can achieve. Let's come together. Let's make world a better place. And that's why we have got, for the welfare of the humanity, the service of the society, we have got Dr. Ravul Jindal ji with us, who is presently working as a director, vascular and endovascular surgery, Fortis Hospital, Mohali in the state of Punjab in India. He's working in the field of surgery for the last 26 years, and he's also the past president of the Venous Association of India. He's also the member of various prestigious international medical organizations and associations. His areas of expertise include peripheral, arterial, venous interventions, and endovascular surgeries, with expertise in endovascular management, revascularization in diabetic foot, laser treatment of varicose veins, CLaCS procedure in varicose veins, mechanical chemical ablation of varicose veins, and glue closure techniques. He's involved in research, presentation of papers at national and international meets, and he has a number of publications to his credit. We are really privileged to have him this evening with us. He has written more than 15 book chapters at the first author in the international books in the field of vascular surgery, and is credited with more than 30 publications in various international journals. He has recently co-authored book on venous disorder published in 2018. Ladies and gentlemen, he runs various training programs, courses on infrapopliteal angioplasty for diabetic foot, AV fistula angioplasties, USG guided punctures, and a very popular EUVIC courses, endovascular and ultrasound guided venous intervention course. He is the director of the EUVIC course, which includes live hands on workshop for varicose veins, where more than 40 live cases are performed with various techniques. Ladies and gentlemen, we all are privileged to have Dr. Ravul Jindal with us. He is going to share his vision, his expertise, and whatever he is doing in vascular surgery, his views on the COVID, and of course, the various marks, vaccinations, and a couple of other things. So join me in extending a very warm welcome, a hearty welcome to Dr. Ravul Jindal. Pleasure to have you with us. Thank you very much for joining us. You have got in the backdrop the Fortis Hospital, Mohali in the state of Punjab in India. Ladies and gentlemen, we are privileged to have Dr. Ravul Jindal, and I would request him to kindly share his views, his expertise, because nowadays the vascular problems are coming quite a bit post-COVID, and people are having a lot of apprehensions, how to go by, which way to go by, what is to be done. And a couple of deliberations are there on the various masks also, vaccination also, and a couple of other areas. With these words, Ravul Jindal.
Thank you. Thank you, Dr. Sharma, for the nice introduction. And I'm really privileged to be here because your association is doing such a lot of good work. And thank you all the friends who have joined all across the world. I'm just going to put in some viewpoints and some pictures. These pictures are of the patients. We have taken the signatures or the permissions from all the patients whose pictures are shown here. Second is, please, there are some pictures which could be some disturbing, but that's the fact. That's the medical science. I have just prepared this presentation for this talk, and which will bring you the medical science one step closer to you, which is not shown on the TVs, if you find, this helpful, I think that would be really great. So I'll start sharing my screen now, and we can take some questions at the end. It's a very, very vast topic. So I have just put in some ideas to what exactly we do. What is vascular surgery? As there's a very important questions, and you'll be very surprised to know that most of the developing countries, see, they don't have many vascular surgeons working. And there are many countries where there are hardly any vascular surgery available in the hospital, and it's being conducted by either the general surgeons or the cardiologists or the CTVS surgeons or the intervention radiologists. I'll put in this small video. You can see this. It's an animation, so, it's not real. It cannot happen in real. But the basic concept here is, if we think that the tiger or the leopard is a vascular disease, so you need to run faster than the vascular disease, because once you have a vascular disease, there is, the treatment is not very good. So we need to protect the patients before they have the vascular disease. So what is vascular diseases are? We got so many vessels in our body. So the heart, in the center, pumps the blood. It goes through the red color vessels, what we call arteries. And then the blood comes back through the veins, that what is blue in color, and the blood goes back into the heart. I've been also told that I should keep a language mixed by Hindi and English, And I'm just a bit confused because if the people are watching all over the world, then they may not be able to understand Hindi. But I'll make
We'll go in English, Doctor. We'll go in English. Yeah. Because
so.
people are joining from different countries and different provinces, you know.
Okay,
Yeah.
okay, okay. So there are vessels. So the blood goes into the arteries, which are high flow, and it contains oxygenated blood, and it comes back through the veins into the heart. So as a vascular surgeon, accept the heart and the brain. So we operate on all the other blood vessels of the body. So you can imagine, so 90, nearly more than 97% of the blood vessels in the body are dealt with by us, and accept the heart and the brain. Heart is dealt by the cardiologist and the cardiac surgeons, and the brain is dealt by the neurologists, neurosurgeons, and the intervention radiologists. If we go to the next, if you look into this, all these vessels, they get blocked. And these vessels, they can get blocked because of various reasons, which you know, like if you are old, if you have smoke, if you have high blood pressure, if your cholesterol levels are high, or because of some genetic reasons. So these vessels, they can get blocked. And these vessels, they block normally slowly, but they can also block very fast. And as you can see, the pipes in the red color, they can slowly block with a process what in medical terms we call a atherosclerosis. And once these vessels block, you get three major manifestations. There are a lot of other ones, but three major. You must all have heard of stroke. You know what we in medical terms we call as TIA or ischemic stroke. You all have heard about heart attack, you know, and you also have heard about the peripheral arterial disease. And peripheral arterial disease in layman terms we call a leg attack, or we also call it as a gangrene of the foot or the hands. So all these medical disease, they happen because some of the red color vessels, they get blocked, and they get blocked because of various reasons. And there are various types of vascular disease. So in some cases, the vessel gets blocked. In some cases, the vessel gets bigger, what we call aneurysm, and they can rupture. And there are also diseases which affects the veins. Veins were which carry the deoxygenated blood back to the heart. Let's start with some pictures. You know, can you see this lady's hand? And then there is another hand on the right side. So on the left hand, this lady had a clot which has gone from the heart into the arm arteries and has blocked it. And medical terms we call it an acute embolism. And on the right hand side, you can see it's a gangrene of the one of the fingers, what we call as a chronic ischemia, arm ischemia. Now, in both these cases, the vessels in the arms are blocked. And today's time is very important because both these things are happening in COVID patients also. So you get a patient with COVID who had a COVID 1 month back, 2 months back, and they present to you clinic with these symptoms. Or when they were admitted in the ICU in severe conditions, they get an acute clot formation in the hand. So once you get an acute block, so this is an angio picture. You can see a CT angiogram, and you can see that patient has got a block of the white color artery, which you can see there is no blood flow which is going into the arm. And this is if a picture while we operate. So you can see where the slings are placed, and this is an artery. So the artery in our body looks like this. So this is a real picture of a patient with an artery shown, and you can see there is a blockage in the center. There is a clot there, which we are going to remove after opening the artery, and we'll make the blood flow into the arm, and so the blood can go into the arm, and we can save the arm of this patient. Similarly, we also see road traffic accidents. You know, a lot of accidents happens, especially in India, and because of the poor traffic rules, and people don't bother about the rules. So once you get an accident, you can get a fractures, and once you have a fracture, it can also injure the arteries because most of the blood vessels, the main blood vessels in our legs and the arms, they run near the bones. And if you look into the road traffic accident, the most common cause of death is a vascular injury. So if you have vascular surgeons near all the highways, on all the trauma surgeons, a lot of these peoples can be saved. Then you can also see patients with a gangrene. So these are all different types of gangrene. And one of the most common reasons which happen across the world is smoking, which is very bad for health, and diabetes mellitus or sugar disease. So both these diseases can cause you these issues. So what happens in this because of smoking and the diabetes is you can see the picture on the right side, an orange color block. So you can see the black color is an artery, which you can see on an angiogram. This is totally blocked. So once you have a blockage of the artery, then you'll get a wounds in your foot, a gangrene or a non-healing wound. So any wound in the leg which is not healing for more than 2 weeks, he must be investigated for a blockage in the blood vessel. So once we improve the blood supply, either through a surgery or through the angioplasty, in this patient, these wounds can they heal up very nicely and we can save the legs of these patients. Then you also see another diseases in our branch, what we call aneurysms. What is aneurysm means? The blood vessels of our body, they gets dilated. Now this can happen in any part of the body. And you can see it's a main aorta which gets dilated, and they can be treated either by an open surgery or we put in some nice stents. So we have placed the stents in this side this patient, and you can make the patient treat this patient with minimal invasive things. Then you can also see a dilated blood vessel into the chest. Now this is a picture on the left side. You can see this is the main blood vessel, what we call aorta, which is coming from the heart, and it bring gives the branches which goes into the brain and the arms. And then later to that you can see a small bulge in the artery, what we call an aneurysm. They can also be treated with stents nowadays, and you can see very nicely the white color thing inside. So this is what we call a stent inside, and the aneurysm gets treated with a minimal invasive. This whole procedure can be done under local anesthesia. Then you can also treat patients with stroke. So these are blood vessels on the black side, which you can see on the left side, they are going to the brain. So if you can see the blood vessels on the which are going to the brain, there is a narrowing there on the black colored thing, and you can treat with either an open surgery or you can place a small stent inside to treat the narrowing in the blood vessels which are going to the brain. So basically, you can get a narrowing anywhere in the body, and that can produce the symptoms, and you can treat them with different techniques. There is another patient who had a trauma. So this patient was advised an amputation. Amputation means cutting the limb because the patient had a vascular injury at 3 different places. So they said it cannot be salvaged. We did this surgery for 11 hours along with an orthopedics and plastic surgeons, and we could save the limb of this gentleman. Then we also operate on the patient with chronic kidney disease because they require a lot of access, like a dialysis access. So all the patients who have got a kidney failure for dialysis, they require a permacath insertions, dialysis lines, fistula formations. So all those surgeries are performed by the vascular surgeons. Coming to the veins disease. So, veins are the vessels which take the blood to the heart. They can get blocked. And one of the most common diseases is deep venous thrombosis. You will be very surprised to know that a data from the US last year all suggested one of the most common cause of death in the hospital in United States was found to be deep venous thrombosis. So you get a clot formation into the legs, and these clots, they can run up into the heart and can block the blood vessels into the lungs, and the patient can die suddenly within a minute. So what we call it as pulmonary embolism. So deep venous thrombosis and pulmonary embolism are very critical disease, and they need to be tackled in a very, very prompt manner. Most of the time, these diseases can be prevented, but there are various causes by which this disease can happen and we can treat them. So this was one of the young patients who came from London to us, and you can see she had got a deep venous thrombosis, and on the right side you can see an angiogram where you can see a white color thing inside the blood vessel, and which has been blocked. So you can see here blood vessels here and a white color thing inside. These are the clots inside. And what we did in this patient was we went inside this blood vessel. We sucked up all the clots from the leg, which has been formed. So she was traveling in Dharamshala in India, and you can suddenly get this clot formation just by overnight sleep. And once we remove the clot, you can see a very good flow into these veins, and this patient can be treated with blood thinners later on. Then a very common disease which affects 8 to 10% of the population in the world is a varicose veins. Varicose veins are where the valves in these veins they are not functional, and you can get a dilated veins in the legs of various different types. It's a very vast topic. And good news is from last 15 to 20 years, we have got really non-invasive methods where we can treat these patients without any cuts or stitches with various different techniques like laser, radio frequency, steam, MOCAs, glue, and patient can get a very good results. So this guy had a lot of dilated veins of both the legs, treated with a laser, and at 6 weeks later, you cannot identify where these patient veins had. Look at the amount of varicose veins this patient could have. Now, don't leave these varicose veins because these veins can go and damage your skin at the ankle, can form a clot formation, the vessels can rupture, a lot of complications can happen, and which is not very good. So we did a laser. So you can see it's a very small needle under local anesthesia. We put in the sheath. This is a laser fiber you can see here. We block the main vein through that. And on table, you can get a result like this. So there are no cuts. It's under local anesthesia and takes around 15 to 20 minutes, and patient can walk home. So that's the beauty of minimal invasive techniques. So that's the advancement. So this is how we treat these varicose veins. So the red color thing is a beam of light showing where the laser fiber is. Then we also treat a cosmetic varicose veins. So this is how the rooms of the cosmetic varicose veins they look like. So we use an NDWAG 1074 machines, and you can treat these cosmetic spider veins. So normally they are not medically important, except if you have an itching or there is a bleeding, but otherwise mainly a cosmetic treatment what is required. And how we treat it, this is what we is called as a CLaCS procedure, where we are using the laser to treat these veins under local anesthesia. We don't require local anesthesia, just a local cream. And we use a laser through the skin under a fluoro and a coolant. And then we can get a very good result, especially in a very difficult situations like in the, if you have a lot of veins in the foot areas, then or near the eyes, then these are a very good technique. Then we also treat the patients with malformations, AVMs, what we call arteriovenous malformations. So these patients can also be treated without any cuts or stitches with the ultrasound guided, and you can see the blueness of the hand which has been cured. Then can you see the dilated, lot of dilated veins on the right leg which has been treated without any cuts in a very nice technique. Now we'll move our radar to the most important thing which is being discussed from last 1.5 years in the whole world, what we call COVID. You can see all the street empty, and I think you will never get to see such photographs in your lifetime after this. Novel coronavirus pneumonia. So this is the latest slide. How many people have got infected in the world? So this is from WHO on 7th of May. And you can see there are some countries which have got affected much more, especially America, both North and South, Europe, and India has recently got really infected. Very surprisingly, we don't know why the South, Africa, Australia, definitely because it's isolated from the world. That's why it may not have got affected. But Africa, it's very connected. but still the number of patients are less there. What does the COVID, or what we call SARS-CoV-2 stay? COVID virus has been with us from 1965 in various different forms. And you can see there are various different names for the COVID. We had a SARS-CoV virus in 2003, and which had got a mortality rate of 10%, which was very high. Then we had a MERS-CoV virus in 2012. You will be very surprised to know that has a 37% risk of dying. Now we had the SARS-CoV-2 virus. SARS means severe acute respiratory symptoms. And it has also got 2 to 3% risk of dying. All these viruses are called as RNA virus. And all of these viruses, they have what we call as spike proteins. As you can see, the blue colored thing on the round, and that is called spike proteins. So whatever antigen tests you do, whatever antibody tests you do, whatever all the vaccines you are looking at, they are all made on the basis of this spike protein. So you can imagine that this is the address of this virus, and we are going to target everything to this spike proteins. And when we say vaccines, vaccines are actually our spike proteins, which we are injecting into you and our body in a low quantity, and our body is forming an antibodies to these antigens. So this is how this virus goes on. How this virus basically affects, there are various 4 different things. One is this virus attack directly the cells of our body. Third is it dysregulates all the mechanical systems, all the physiological systems in our body. The third is basically it goes inside the blood vessels, and on the blood vessels, it causes a lot of things by which the vessels they leak, the vessels they block, by which it gets all the other dirty things which happens in our body. Then it also affects our immune system, by which you will see there are some patients who die much faster, and there's some patients who die later. And if you look into the systems, what the COVID affects, you can see that it affects nearly the whole body. If you look into the brain, one of the most important things it affects is causes stroke. It causes Guillain-Barré syndrome. In kidneys, it can damage the kidneys totally. It can damage the liver. It can cause you diarrhea, nausea, vomiting, abdominal pain. It can cause you clots in the deep veins, clots in the lungs. In the heart, it can cause you a lot of things, arrhythmias, shock, heart attack, and it can cause you diabetic ketoacidosis, high level sugars, low level sugars, and it also causes you a lot of skin changes in you in terms of rashes, urticaria. So actually it can affect you in a very big way. So do we have any data to support that COVID is associated with blood vascular disease? So there have been a lot of publications now, and especially in this second wave, we found, especially in India, that the COVID is affecting the blood vessels in a very big way. So what we have found is that in moderate to severe COVID, you get much more vascular disease as compared to in the mild COVID. And there have been a lot of treatment guidelines which has been formed by the various societies in the world in terms of how can we prevent a vascular diseases in these patients. So what we have found is that if you have a very early response, in that phase, there is no point giving the blood thinners. So what we can do in all these patients is we can give you a blood thinners. So, but in the second stage to third stage of the COVID, we can give you some blood thinner by which you can protect the blockage of these blood vessels. So now it's this very standard technique in all the ICUs where we are managing the COVID, but sometimes we are not able to give the blood thinners because COVID has also affected the other medical system where we cannot use the blood thinners. If you look into all the guidelines which has been published, they show that we should use the blood thinners in moderate to severe COVID disease. And it's also been shown that once you discharge from the ICU, in the moderate to severe COVID, then we should continue the blood thinners for few days, because we have seen now in our practice, approximately last month, we saw 10 patients with a clot in the deep veins, which has happened 1 to 2 months later after the discharge of the COVID. Because you have to understand, even you are better, even your COVID test is negative, but the COVID inflammation, the body's reaction to the COVID continues for 1 to 3 months to 6 months. So that's why we also tell people not to start doing heavy gym or heavy running at least 30 to 45 days after you recover from the COVID disease. I'm going to put in 3 or 4 cases which we have seen in the last month in our clinical practice with COVID. This guy had COVID 1 month back, now came to us with sudden onset block in the right leg. No comorbidity at all, no other disease, just had a COVID a month back. And this leg was very bad, very ischemic. And you can see on an angiogram, the whole leg was blocked on the left side, the black color thing. There is no blood going into the foot. We removed the clot from his leg, and luckily we were able to save his leg. This is another guy in our ICU, COVID pneumonia, on a lot of blood, pressure medicines, because the blood pressure is very low, and he developed and blocked in the right leg. Now, patient is very sick, so we can't operate on the blood vessels, but we can give the blood thinners, and hopefully that this patient's foot will survive. But most probably, this patient will lose half of his foot later on. Then patient also presented to us because the patient had uh, affected the liver and the kidneys. His blood vessels were, his blood was thin. He presented to us with a sudden onset, spontaneous rupture of the artery in the groin, which was because of the COVID, which was is a rare thing, but it happened. So he presented to us with a leakage from the vessels, which we treated, and we could save the patient. This is a swelling in the leg. So if you have a sudden onset swelling in the leg or in the arm, we must rush to the hospital to make sure that you don't have a clot in your veins. So you could have a deep venous thrombosis, which can be treated with medicines very easily. So take home messages are, we must ensure all patients at risks for the clot formation both in the arteries and the veins with COVID. And all these patients must have an appropriate blood thinners, uh, you know, and if you have some of your relatives admitted, then you must ask the doctor that I hope these patients are on blood thinners. And if they are not, there should be some reason why they are not on the blood thinners. If you have COVID, then there are various changes in the lab parameters. As you can see, your platelets can go low, your blood can become very thin, and especially one very important parameter is a D dimer. Why I put in this slide is we got a lot of patients coming to us with D dimer reports. That my D dimer is high. What should I do? I've been told that I should be started on blood thinners. You have to understand what is D dimer. Anybody who can get a cough, any viral illness, you see pregnancy, accident, post-surgery, your D dimer levels will go high. So D dimer is a non-specific inflammatory marker which will get rise in your blood vessels, any inflammation. So just mere D dimers are on the higher level does not mean that you need to be started on the blood thinners. So you need to make sure that why your D dimers are high, you need to be investigated. And if we found that there is some reason, then yes, we should be started on blood thinners. But high D dimer means high inflammation in the COVID. So yes, D dimer higher levels has got a prognostic values in the cases of COVID disease. Then we also get questions about the antibodies, COVID antibodies. You see, it's a lot of controversial topic and a very vast topic, but I have just shown you this chart to show you how does the antibody response happens after COVID. In the first part, asymptomatic stage, in the first 1 week, you get a RNA, very high levels of RNA. And then in the next few weeks, you will get high levels of antibodies, and then the antibodies level will go down. And the only antibodies you could be able to identify mainly will be an IgG antibodies. Coming to antibody testing, it has got a limited role in the diagnosis of COVID-19. And more data is required regarding whether antibodies which are detected in a body, they confer immunity to SARS-CoV or not. Because you could have an antibody higher levels detected in your body, but you can still get COVID. We still don't know what is the level of antibodies, what is required in our body to protect us from COVID. So that's why just doing an antibody testing and then be brave that not to wear mask and going out in the public is not the right thing to do. Coming to the mask. Now, mask is a very, very important topic because that's the main thing which you are going to protect you. I have seen a lot of people, you know, going into the public space and they are very, very close to each other and they are just wearing a simple cloth mask. You have to understand there is a difference between mask and respirator. When we say mask, mask can vary from a simple cloth mask, which you can see on the picture, the girl and the boy are wearing, or could be a simple 1 rupee mask, which will just protect you from spillage or very small protection from the particles. As compared to the respirators has got an airtight seal. What that means is if there is a COVID in the air around you, it will not go inside your lung. But if you're wearing a cloth mask, it will not be able to protect you if somebody is sitting very close to you with the COVID disease. Second is the terminology. I feel is a very, very important thing to learn. I think everybody should know. Masks are identified according to two things. One is the nomenclature. As you can see on the mask is written N95. You must have heard this name a lot, N95. So what do you mean by N? So there is a terminology called as NRP. All the masks are associated with NRP category. N means not resistant to oil. What that means is if you are wearing a mask and if you put an oil on this, the oil will go through it. And R means it is resistant to oil, and P means is an oil proof. So why I'm talking about oil here? You have to understand all viruses are lipid based. All the viruses, their walls are lipid. They're made of oil. So the more resistant it is, the less chances are that the oil based virus things will be able to go inside. But the virus particles are very small and the amount of lipid which it contains is very, very, very small. So even the N not resistant to oil mask are really good enough for the protection from the coronavirus. So that's why it's very, very important to understand what that NRP mask means. Next important thing is you have also heard N95, N99, and 100. So what that means is 95% of the solid and the liquid particles will not go inside your body if you are wearing this mask. And these are tested in a very harsh conditions. So if you are wearing an N95 mask means 95% of the particles, aerosol particles, will not be able to go inside. If you wear the N95 mask properly, not if it's hanging around like this, not fitting your mask face properly, and you're not wearing it properly, then of course it will not protect. But if you're wearing an N95 mask, which is approved by the agencies like an OSH or occupational agencies which are there, OSH, then it should protect you. Now, these are various different marks which are available. NPR. So it could be an NPR or it could be a 95% protection, 99% protection, or 100% protection. But most of the public, I feel when they are in the public space, they should be using an N95 mask. Coming to the vaccine, last topic, key facts about the vaccination is that getting vaccinated can prevent you from getting moderate to severe COVID-19 disease. People who have already gotten sick with COVID-19 will still get benefited with vaccination. COVID-19 vaccine itself will not cause you COVID-19, okay, and will not cause you test positive also. So there is a belief that we will not you want to use a vaccination because if you do a test of COVID, RT-PCR test of COVID, then it will be positive. So it's not right. So what are the benefits? It will help you getting sicker, so you will not get sicker. And all the vaccines which are available in the world, they have been WHO approved, except the co-vaccine, which is getting approved, we have heard in the next 1 or 2 months. But all the vaccine has shown to be very effective. If you get this vaccination, more and more people get vaccinated, the faster we will be able to get to our normal lives. So that's the beauty. So that's why we recommend that everybody should get vaccinated. Very important question people ask, how do you know these vaccines are safe? So how do we test it? First, we make the vaccine. Then we do a trial with a small group of people, then a specific group of people, then a huge number of people, like a 40 to 50,000 people. And then we monitor them for 1 month, 3 months, and 6 months period. And once we know that it's safe, then all that data goes to the CDC in Atlanta. And from there, they give the recommendations to the FDA, and you get an approval that this vaccination is safe for the people to use. So can I get COVID-19 from vaccine? Absolutely not, because you cannot get it because it's a very, very low dose. Do the vaccine have side effects? Of course, all vaccines have side effects. You see, what we are doing is we are causing you a mild COVID in a layman terms. So you will get all those viral symptoms of headache, fever, pains, muscles, chills. But all those side effects will last for 24 hours to 5 days, and you should get better. You can take a paracetamol if you get these symptoms, and nothing to worry. Serious side effects like a facial nerve palsy, or some people get deep venous thrombosis or a clot formation, they are very, very rare complications. Should someone with allergies get these vaccinations? If you are not allergic to any products which are there in the vaccination, you can see the ingredient lists which has been posted by the government on the FDA, then there are very less chances you will get any allergies. But if you are allergic to anything, please do inform your doctor. I like to have a baby one day. Is it safe to get a vaccination? Absolutely. The taking a vaccination does not affect your fertility. Can someone who's pregnant or breastfeeding get a vaccination? It's very controversial, but the recent data by the American College of Obs and Gynae has recommended that uh, the benefits outweigh the risks. Then the people should get a vaccination. We don't have much data about the safety though in pregnancy and breastfeeding, but scientists haven't found any safety concerns clinically. We are still getting the data collected, and still it's a personal choice to get this, but there are some recommendations coming up that we can take it. Are the vaccines safe for children? The Pfizer has been authorized above the age of 12. The Moderna and Johnson's are authorized for people above 18, and younger than 12 at present does not require a vaccination. Will vaccine change my DNA? Of course not. You have to see in our body, the DNA is present in the nucleus, in the cell. So whatever we are doing with this, it does not affect the virus does not go inside our DNA. It does not affect that. How long after getting the vaccine does it take to be affected? You see, once you get the 2 doses, after 2 weeks after the second dose, normally you should have enough antibodies to give you a protection. Do I need to keep wearing a mask? Of course, definitely. Because you have to understand, even after vaccination, you can get a COVID disease. Though you may not get a moderate to severe disease, but you can still get it. So after vaccination also, you should cover your nose and mouth. You should follow all the guidelines, stay 6 meters, avoid crowded places, wash your hands. And all those precautions we must continue. So you have to understand COVID is a multi-system disease. It has got implications for, short-term diagnosis is difficult. Medical science is really learning every day. And severely ill patients has got a lot of vascular malformation manifestations, which we are seeing in the last few months. And that's why we want that everybody should get vaccinated, so we have less and less admissions with moderate to severe disease in the hospital. Thank you.
Thank you, Dr. Saab. Wonderful, wonderful. In fact, you have covered the entire subject in so much of details. Each and every segment you have tried to cover the best possible way, and people had a lot of myth. People had lots of doubts. I think quite a bit you have covered in your presentation itself. I will quickly take on, Dr. Saab, some questions so that we can accommodate maximum people. Sure. There's a gentleman called Mr. Vikas Malhotra from Canada, from Toronto, downtown Ontario. What is the minimum gap between the two vaccine doses, Dr. Sahad?
You see, the minimum gap depends upon different vaccinations, because there are various vaccines, but at least 4 to 6 weeks should be kept for the minimum gap. What is the guidelines which are showing now? As I told you, we are still learning. And in some countries, people have put in, the gap as 8 weeks to 12 weeks also. And that is the reason. The reason for that was so that people, there was a shortage of the vaccine in some countries, and people felt that we can cover at least with one dose maximum number of people in the world. And I think this is the changing scenarios. But your in short, your answer will be at least 4 to 6 weeks.
Okay, thank you very much. There is another gentleman, Mr. Vimal from London. Great, elaborate information indeed. Doing a great job. Keep doing, Dr. Jindal. His question is that the first dose and the second dose, is there any change in the medicine or something, or is it the same medicine in 2 doses?
No, it's the same medicine.
It's the same medicine. Okay.
You see, how does it work? Yeah, that's why I put in this picture. When we are doing the first dose, we are giving you a small dose of vaccine, a small dose of spike protein. You know, the vaccine, I showed you the virus. It goes inside our body, and it gives an instruction to the cells of our body to produce a lot of spike proteins. So our body produces a spike proteins, a lot of spike proteins. Then in response to that, our body produces a lot of antibodies. So it takes 4 to 6 weeks to produce some dose of antibodies. Okay. So after some time, we give you another small dose to produce more spike proteins. Because now our immune system is immune, he knows that how to produce this production. Then after second dose, it produces a lot of antibodies. Okay. So by which it gives us a protection.
Great. Non-lie, Naanlie. I took D-dimer test after 5 days of getting myself positive. Is it okay to take that test during the sickness?
Yes. You see, D-dimer, as I told you, it's a prognostic indicator. So both D-dimer, CRP, and interleukin-6. So we measure these inflammatory markers once you are positive for COVID virus. And then we also measure it after 3 to 7 days to see how is the inflammatory response in your body. Because if these levels are very high, off the roof, then it has been shown that we keep you on a very close follow-up, because what that means is there is a more chances of you getting a moderate to severe disease, means the COVID can get worse. So then it's good you did a D-dimer in your early phase, and normally they all settle down within 3 to 5 days if you have a mild disease.
Okay, thank you. There are two another dignitaries, and one is Arumugam Srinivasanji. He says even after 2 doses of vaccines, people are getting affected with the COVID. And there's a J. Subbalakshmi. Does it react after vaccination despite a presence of antibodies already in the body? So I think you have tackled quite a bit already.
Yeah. I've told you. Yeah. Having a vaccination does not mean you cannot get a COVID. because it is just getting you have got an antibodies in you, so you can
Mhm,
get any viral infection. You
mhm,
can get any it's an influenza virus, so you will keep on getting any influenza virus in your body. It's not
mhm.
that you are protected, it's that those antibodies may be able to protect you from getting severe disease. Okay, so
There's
you can get COVID-19. You
uh,
continue to have precautions.
okay. There's Nishank Maurya. Most of the Indians are there. Those are watching this
Yeah, yeah.
program. Our
Yes.
NRI brothers and sisters. So he's writing, Nishank Maurya. Usually, people recommend natural antibodies post-COVID is preferably good than the vaccination. Although you have answered, could you be kind to amplify a little bit?
You see, if you are right in a way, but there is very controversial data. One is,
Hmm,
if I make sure that everybody in the world gets COVID,
hmm,
then you will get 3 to 4% of the world will die
hmm.
before you get a natural antibodies to all, which we don't want. Okay, so what we are doing is we are giving you a vaccination by which you can prevent the risk of dying to so many people. So that's the advantage. That's why we don't want that everybody should get a herd immunity by natural infection, because then you will be killing a lot of people by that, which we don't
Okay,
want, of course.
okay.
Second is,
Mr.
sorry, anyway.
No, please go ahead. Please go
Yeah.
ahead. Second
Second is,
is.
vaccination gives you an antibody, but it does not protect you from getting a COVID-19 infection. I'm again saying that.
Yes. Mr. Vikas Malhotra from Canada is a tourism expert. He's telling it's really an eye-opening, Dr. Jindal, what you have mentioned today. Such a elaborative talk. Thank you for the session. Is there any physical exercise that can be done by human beings post-COVID after recovery, like some soft exercise?
Yes. You see, as you know, the COVID affects your lungs and the vascular. So what we recommend is, the best exercise for this is a simple breathing exercises, what you find in yogas: deep breath in, deep breath out. And second is, you can go for normal walks, not like very heavy exercise based. The normal walk, is the best exercises, because that will take care of your musculoskeletal system, of the vascular flow, and also the breathing. And but keep yourself hydrated if you are in a hot weather.
Keep yourself hydrated.
Yes, because
Oh,
dehydration can cause you, vascular thrombosis, so which we don't want while the inflammation is high.
okay. There is another question coming from London, Doctor.
Yeah, yeah.
That is, can there be a combination of the first vaccine and second vaccine by two different companies?
Yes, you see, the most of the trials has been done in UK only,
Hmm,
because then they started giving two different vaccinations, and there have been publications with that.
hmm.
Now, one school of thought is, the two different vaccinations can be given, sorry, not should be, can be given, where where we don't know what vaccination the patient had on the first dose, where the first vaccination may not be available. The patient has Covishield first, and then the other Covishield is not available, then you can have a Covaxin. Where there is a shortage of one vaccination dose, and then you have a second different company, you can take it. Now, fourth is, there is some studies which shows that maybe that if we target two different vaccination, we'll get a better antibody response,
Okay,
but we still don't know. So at present, if you look into the guidelines, we should follow the guideline, not into the research. If you look into the guidelines, at present, we recommend that you should take both doses of the same vaccination for the time
okay,
being,
okay.
unless your government, locally government in your country, or your doctor suggests that, okay, you can take it. But I have just told you why you can take it.
Okay, great. There is Ishita. I have done my D-dimer and antibodies test after 1 month of recovery, and the antibodies is 8%. So is it fine? The antibodies present in the body?
I've told you that. That's why I put in that slide. You
Yeah.
see, we personally don't, I haven't got my antibody tested any time in my life. And
Hmm,
my wife has tested 5 times.
hmm,
Okay. So it's very individual, because mm, personally, if you look into the data which has been published, just doing an antibody testing as a routine is not required in anybody,
hmm,
because even if you have You know why? One is there is a false in the testing,
Mm.
because the kits by which we test the antibodies, sometimes they are not able to find the right quantity of antibody in the test. So just you having an 8% does not mean you don't have an antibody. Second is, by when we do the test, we just test the humoral antibody. We don't test the cellular immunity. So COVID vaccination or the COVID itself also gives you a cellular immunity, means T cells and B cell immunity, which cannot be tested. So you could have a very good cellular immunity by COVID, a vaccination, and you could have a very low cellular humoral immunity, and you could be still very protected. So, medical science. So third is, we don't know what is the level of antibodies in your body which will give you a protection. So I don't
Okay.
know. So
Okay.
actually talking, so just forget about it. If you have got the vaccination done, and then just continue that, and keep on taking the precautions. So
Okay.
you are protected.
Final question, Dr. Saab, we will take. There's a lady called Julie Subba.
Mhm.
She says, although it's a little difficult, she says the COVID-1 had come and we became little complacent in September onward or something. And all of a sudden, the second wave thereafter hit us very badly. How do we, and how true are we, and how near the reality are we? Will there be a second wave or it will not be?
The second wave is we already
No,
in.
third wave.
Yeah,
Third
yeah,
wave.
yeah. You see, uh, according to me, and the way it is, the way uh, the virus is mutating, the new strains are coming up. I personally feel, I'm talking about India, every country is different, but I personally feel that there will be a third wave in the world. Uh, what we are trying to do with teaching, with vaccination, is that the third wave comes in, people gets infected, all the people gets mild disease, there are no ICU admissions, and there is a very, very low mortality. That's what we are predicting. So, because the virus is mutating, nobody 100% can predict where there will be no third wave or there will be a third wave. But according to the virus behavior and the literature published, what we think is that virus is mutating and the new strains will bring up the third wave everywhere in the world. And our main aim by the doctors and the medical and the public should be that all of us gets protected, and if even if the virus mutates, we hope that the vaccinations what we are using is they will give us a protection with the mutant virus, which we still don't know. So I really don't have the complete answer, but the medical science is learning every week. So
Yes.
the news what I'm giving you is now maybe totally changed within a month's time.
Okay. Okay. Thank you. This gentleman called Hemanji, I think I got to take on one more question.
So please carry on.
Oh, Hemanji, does vaccination raises platelet levels in the blood? If it rises, whether one should take blood thinner or aspirin?
You see, uh, as such, vaccination itself will not affect your platelet counts.
Okay.
Okay. But normal platelet counts, if they are there in you up to 300,000, you don't need to take an aspirin, definitely not. But if you have other comorbidities and there is a clinical indication, then you should take an ecosprin, but not just as such.
Okay. Vikasji is writing from Canada. We just had the third wave in Canada of the COVID. Now we are getting better.
Yeah.
Now we are getting better. So that's great, Dr. Shah. Such a wonderful and amazing session. So informative, so educative. And you put such a vast plethora of the information in such a concise, precise, and such a pragmatic way. I personally feel that great salutations to you. We wish you all the best, Dr. Shah, in your task, in your work, in your future career. And we pray to Almighty there should be more youngsters. I'll call you youngster at my age. We should
Yeah.
have more such Dr. Rahul Jindal ji in the country, in the universe, and to serve the humanity the best possible way. One final word before we close this session. What would you like to tell the humanity as a doctor as a human being, as a well-wisher, and as a futuristic.
Yeah. I'll tell that, working in the medical science itself is very difficult. If you are, if you are a real human being, uh, in last 1.5 years, it has really shaken up the medical fraternity, really shaken up. Uh, because what we have seen with our eyes, I think it has really put all of us into the ground. And that, nobody is above, I will say, the virus or the God or the disease, you know. So I personally feel that there are some instances where in our country, I'm sure in other way, where people have really broken the hospitals, attacked the doctors and the medical fraternity, where they are not able to understand what the disease is, the disease process is. The medical fraternity overall is so stressed, and with limited facilities. So I will request everybody to please behave responsibly as as a human, and think, we have lost more than 700 doctors in India because of the COVID. And so that's a huge number. And you have to understand, people are putting their own life at risk. And so I think everybody should behave responsibly. I also, I see in the future, I feel that everybody should behave responsibly in terms of taking vaccinations, follow protocols as much as possible. And so that, we can not give a chance for the virus to hit us again in such a bad manner. And I think another thing is, this is a very good time where the whole world has come together to fight against one disease.
It
And I
is.
think this is a really what humans are.
Wonderful. Thank you very much, Dr. Rahul Jindal. Ladies and gentlemen, that is Dr. Rahul Jindal from the Fortis Hospital from the state of Punjab in India. And he shared his entire vision, expertise, and what is the present prevailing condition, how you can protect yourself. We all got to be together. It's a Vasudhaiv Kutumbakam. That's the way we have to go by. Stay tuned in tomorrow morning, 9:30 a.m. We will take you to Los Angeles. Thereafter, 11:30, we will take you to Bollywood. 3 o'clock, we will take you to the northeast part of India and the ASEAN. And tomorrow evening, 8 o'clock, you will go to Texas and the Lamar University and the NASA. With these words, our deep regards, gratitudes, thanks to Dr. Rahul Jindal for having spared his valuable time, and particularly when he has touched a very emotional chord that we lost 700 doctors. Ladies and gentlemen, our deep condolences. The great warriors, the great heroes, while saving others, they lost their own life. I think they have done a great job, and they are doing great job. Our great salutations as a soldiers, as our chamber, to all the doctors, all the warriors, and all the paramedical and the supporting staff, those are into the medical fraternity. Thank you very much, Doctor. Thank you. So green morning, green afternoon, green evening. Stay